Hi, my name is Spencer Moffett. I'm a chaplain with Lake Valley Hospice, and today we're going to talk about hospice and family support. When it comes to caring for patients and their loved ones, that might include family, it might include friends, it might include just associates. You never know. Hospice, the beautiful thing is that we provide support to everyone involved in caring for the individual. It's not only person-centered, it's, one could say, family-centered, and that we are able to alleviate some of the stress and the anxiety and the fear that caregivers have when they're taking care of a loved one for a long time, when the care gets more intense. So when hospice comes in, we're looking at everyone who's involved, and we are trying to see what need we can support. And so it's an open door, it's an open conversation, and everyone's invited. So hospice clinicians are trained in grief support. We are able to perform assessments that inform the bereavement care plan that gets tailored for each individual. We ask each person what they're comfortable with for that next year. And so that can look very different for different people, especially when you add the fact that we process grief uniquely. There's no two identical ways of processing grief. It really is unique to the person. So it requires a curiosity and an attention and an empathy from someone who's listening to really be kind of assessing and helping come to a conclusion as to what kind of support is needed and desired. Some people have gone through grief multiple times of losing a loved one, and they're more of a veteran, but a lot of us are brand new to it, and we're not sure how to process it. What we do is we offer monthly mailings that kind of focus on one aspect of grief and the grief journey, and helping to create bite-sized moments of grief support that provide learning, that provide normalization, that provide different creative ways of moving through one's grief, which might be an activity of journaling or an activity of drawing or coloring. There are various ways that people decide and choose to cope with grief. It could be taking a walk, it could be some kind of distraction or a pet or a loved one. So those kinds of pieces of information are important when creating a bereavement care plan. Our job is really just to kind of ensure that people feel they have the amount of support that they need and want.